Tim?
Well, joint pain is something so many people suffer with, especially as we get older. The knees start getting creaky, the hips start making some sort of weird popping noise. I don't know what that is, but the question is, when do you go to see a professional? A professional like, say, these two guys. I'd like to welcome Hartford Hospital orthopedic surgeon, Dr. Mark Shekhman. Thank you very much for taking the time.
Thank you for having us.
And Ray Shaw, physical therapist, and you are the director of the Hartford Hospital Rehabilitation Network.
Right, in Avon.
In Avon. Thank you so much. Okay, well, let's just start with the basics. I know a lot of people out there have some joint pain, and like we said, it's the hips and the knees a lot. How common is it, and in the cases there are, is it usually just osteoarthritis, or are we looking at the same cause a lot of the time?
Joint pain, affects millions of people around the United States and in the world. And the arthritis is the most common reason why people have these problems, and hip and knee pain particularly. But there are many reasons why one can have problems. You need to evaluate it and see what the problem really is.
Okay. And at what point do you think they should start seeking that evaluation out? You know what I mean? If it's something that's just going to happen and it's a part of getting older, it sometimes can become tough to figure out when do we need to hit some intervention.
Everybody has a little bit of pain here and there. My knee hurts, my hip hurts, but often it goes away. It gets better on its own.
Yeah.
But when something's more persistent and commonly reducing your ability to get around and do your everyday activities, perhaps that's the sign when it's time to go and see somebody.
Ah, so once it gets chronic is basically what you're saying.
Absolutely.
Okay. Well, yeah, I want to talk to you about that because I know for a lot of people with joint pain, there's somewhat conflicting, I think, ideas in their head. The more active you can get, the more you can move around, the better off you're going to be. But at the same time, that's just putting more wear and tear on a bad joint. So how do you sort of reconcile the two?
Well, there are many different forms of exercise. We like to emphasize with our patients that there are options. There are options that have less weight bearing. There are options that involve more of the strengthening component that we're looking for and maybe get their cardiovascular benefit that they might need to lose weight, to offload the joints, to wear braces, to use assistive devices when necessary. Rest is an important part of managing a painful joint.
I'm imagining this would be, instead of the treadmill, maybe we use the elliptical machine. Instead of jogging, we do swimming. Are there any other little things that some of the people out there getting up to 70, 75 might be able to do on a daily basis without having to go too far?
Very simple things they can do every day, like a stretching routine. I tell people that calisthenics should be a part of waking up and having your coffee in the morning. Do something to promote good joint health. Check to make sure you have good mobility. Like Dr. Shekhman said, if you every day are waking up with pain, it's pretty much a sign that you're developing some form of chronic arthritis.
Yeah. Now, how do we know when the chronic arthritis gets to be too much, doctor, and we need to start looking at replacement?
Really, disability is the key. So a person who can get by on a daily basis and have tried various techniques that we have to make their lives easier through medications or injections or various other techniques, but when those things no longer work, when we've tried everything, exhausted all our options, at that point in time we might look at some various form of maybe surgical option. And we've got fantastic options these days to get people back very quickly, back to their daily lives and getting them to do what they wanted to do.
Yeah, and we're not all just talking about replacements. Based on your condition, there's osteotomies, there's all sorts of things that we can't get into now. Talk about the role, Ray, that physical therapy plays in that. I think I've done some stories on hip replacements where they're saying people, they want to get you up within hours.
Absolutely. Yeah.
And that's surprising.
Well, in fact, I think the role of physical therapy now starts pre-surgery. We want to make sure we have the best outcome possible, and helping patients to go into the surgery healthier helps them come out a bit healthier, and getting up on the day of surgery and being more mobile really sets a precedent for what's being expected of them once they leave the hospital. They really now have a responsibility to stay active, to do the physical therapy, to do the recommendations of their surgeon on a regular basis. People who do their homework get better faster.
What about nutritionally? I mean, now a lot of people are seeing glucosamine, chondroitin. I don't know, is that snake oil? Is it something that you can just take pills for?
Well, I don't think that it's snake oil, but most physicians will say that the evidence isn't strong in favor of the fact that it improves people's function. It does somehow help with people's pain. people do report less pain when they're taking something for it.
Okay, great. Doctor, tell me about the free event that's going on.
So we've got this wonderful seminar. Harvard Healthcare often presents these seminars to the general public. The purpose is really just to give general information to the public, understand what kind of medical advantages or advances we have these days with treating their joint pain. And we're having this seminar in Avon.
Yeah.
This
right
is
at the senior center there.
The unique thing about the seminar is that it's about, it will incorporate a number of multidisciplinary specialists, experts, to help you understand what things can be done for you, including myself as a physician. We've got physical therapy, and also the home care strategy. Ross Davis, who is our home care representative, who will explain to people how we can get back to our daily activities faster. After surgery.
Okay, and there you saw the information right on. Doctor, thank you very much. We do have to run. Mr. Shaw, thank you for your time. Shots from 10 to 12 on the 14th. We have to run, but still ahead on Morning